First question comes from Natasha MacDonald at Radio Canada. Please go ahead.
Hi, Natasha.
Hi, Premier. What is your government considering for the holidays? As you know, Quebec released a clear framework yesterday, 10 groups allowed from the 24th to the 27th, as long as they isolate before and after. Why isn't your government providing the same clarity today, and what can Ontarians expect?
Well, over the next few days, we'll be rolling that out. So just bear with us. We're working with the public health table right now.
Follow up?
Can you give more details about fines, penalties? Will you bring down the hammer if people don't listen to these restrictions, abide by the lockdown?
I don't like, Natasha, using the word bring down the hammer, but, people have to abide by the regulations and the guidelines set forward by the Chief Medical Officer of Health. This is the only way we're going to get through this. I know it's difficult for everyone. What we're doing everything we can to avoid the spread into other regions. Right now, it's Toronto and Peel. It's absolutely critical we follow the guidelines laid out.
Next question.
Next question comes from Cynthia Mulligan at City News. Please go ahead.
Hi, Cynthia.
Hello, Premier. Over the last few weeks, you have been repeatedly saying that it's people having social gatherings, private parties, whooping it up, that are responsible for the spread. Yeah. What in this is actually going to target them?
Yeah.
It's like you're penalizing these businesses like outdoor patios, but it's not doing anything to stop the people that will still flaunt the rules and have indoor gatherings.
Yeah, we put forward the largest fines in the country of $10,000 for anyone who's holding large parties. As Minister Elliott just mentioned, the fines are $750 per individual. But Cynthia, I'm really hoping in this crisis at this point that people are actually listening. And I truly believe even in Toronto and Peel people, vast majority of the people listen to us, but it only takes even 1% of the population not to listen, and it starts spreading throughout the community. So I'm asking everyone, please, just follow the guidelines. That's all we're asking. And we're gonna get through this.
Follow up?
Okay, can you say how long you expect these measures to last? And as my teenage daughter just angrily remarked in the background, so I can go to school, but I can't have one friend over in my house. Like, how do you justify that?
I fully understand, and tell your daughter I apologize, but this is for the health and safety of her grandparents, for you, Cynthia, for me, for everyone. I'll pass it to Dr. Williams.
Well, it's a good question, and thank you to your teenage daughter for raising the issue, because at this time, we have seen, especially in some of our areas, the 14 to 19 age group coming with the highest rates recently, and we're concerned about that. That means we know they can do their part, have to be really careful, really use the virtual tools that you're so adept and excellent at using. Connect on that. You have your time sometimes if you go to the school for your in-classroom setting with masking and other procedures. So it is a tough one. If we do this stringently, and if we can back off this will be great in that. But I think it's the youth and that they can do it. I know they have done it before, and they can do it again. And so we have full confidence, and their ability to use social media and other methods, they outshine us all. So I think they can make that connectivity really well, but it's not easy, but we ask them to hang in and do their part too. We're all in this together.
Next question.
Next question comes from Brian Lilly at the Toronto Sun. Please go ahead.
Hi, Brian.
Hi, Premier. I understand it's your birthday, and you're not excited to be announcing this on your birthday.
That's for sure.
But nobody's excited to hear about it either. Still, happy birthday.
Thank you, Brian.
I wanted to hear primarily from Dr. Williams, but if you'd like to comment as well on data. The province of Alberta has started to release data on the average age of people who died from COVID-19, average age of people in the hospital, comorbidities of those who've died, and turns out 75% have 3 or more underlying conditions. So I know I've asked about this information before, and Dr. Williams, you've said you don't necessarily have it, but wouldn't that help in Dr. Williams formulating recommendations, or you, Premier, understanding who's being hurt the most by this, and then targeting measures to protect those who need the most protection?
Brian, I'll pass it to Dr. Williams. I agree with you 100%. When they give me the numbers every single night, the first thing I ask, how many people passed away in long-term care versus the general public? It's very important. Again, I agree with you 100%. We'll do everything we can to get those numbers over to you. I'll pass to Dr. Williams.
Well, thank you, Brian. And we've been getting that data to say, does it represent, mirror what's happening in the community? The hospitalizations, the ICU admissions, the deaths they usually follow later. We usually get a period of delay between the hospitalizations, those going to ICU, and then the deaths usually happen afterwards. When you're identifying people at a certain age is one factor. People with comorbidities. And you have to understand that there's a lot of people under the age of 80, 70, 60, and 50, and even people under the age of 40 with a number of one or two comorbidities. And we have some deaths in those age groups in that category. So it's not that people under 80 are not exposed to it, and people these days with the advantage of good quality medicine are doing quite well, but they do have these comorbidities. Some have had immunosuppressive therapy for other things, so there's a lot of susceptible, even children in our society that we have to look out for and be careful of. The fact that we stemmed that off so far, I think it's a success to our healthcare providers, our specialists, intensivists, and others in the hospitals. We have learned a lot in that, and I can only wish that they will continue to do such an excellent job, but we don't need to overload them with that, and we don't need to test that by getting everyone infected, and especially people with predisposing factors at all age groups. So our data shows us that the hospital admissions reflect the community transmission areas and the same demographics in that. As for the results of the care, we hope that it'll be highly successful by our specialists and caregivers to keep those ICU cases length down as well as deaths down, and we would only want them to do their best.
Follow up?
I'm wondering what the next step is after this. I know one of my colleagues asked about Christmas, but once this lockdown ends, we will open up to a degree, and between now and when spring comes, cases will rise again. And I'm wondering how often we go through the cycle.
Yeah, another good question, Brian. You know, we're going to have to see how we go over the next 4 weeks, and hopefully these numbers are going to decline. We see what's happening around the country, especially out west and around the world. And this is nothing to brag about, but we still have the lowest cases, and it's not anything to brag about because the numbers are going through the roof, and they're just going through the roof a little higher than what we're facing right now. But we have to be diligent. On a separate note, Brian, I have to compliment you because I left the house, and my wife, Carla, she says, the only person's articles I collect and she cuts out is your articles. And she left me with a comment to tell you that everything that Brian's saying in his articles, there's always truth to what he's writing. So that's the highest compliment I can give you when Carla's collecting all your articles. So thanks for writing those.
Next question.
Next question comes from Colin DeMello at CTV News. Please go ahead.
Hi, Colin.
Hi, good afternoon, Premier. And on behalf of the entire Queen's Park Press Gallery, I wanted to wish you a very happy birthday today.
Well, likewise to you tomorrow, Colin. Happy birthday,
thank you very much.
And Cynthia as well on Sunday.
Makes sense. So you're effectively closing malls in Toronto and Peel region, but you're going to be leaving malls in York region open. People can't attend their local mosque or their Gurdwara in Peel and Toronto, but they can go to one in another region. Yeah. Human nature being what it is, and people are going to travel. Did your government consider any kind of a travel restriction to ensure people don't spread the virus to these other regions?
Yeah, this was discussed in depth, and this was mentioned. I will send it to Dr. Williams, but this was in depth discussed. Also, places of worship, that was an hour-long discussion. But at the end of the day, and I'm a big faith believer, and I support our places of worship like you wouldn't believe. At the end of the day, I will listen and always listen to Dr. Williams and the health table. And places of worship were a tough one, let me tell you. But I'm not going to waver. We're always going to listen to the medical advice. I'll pass it to Dr. Williams.
So, Colin, the question of travel is an important one. We are asking people who are in the high areas not to go to lower color areas in that aspect there, so that doesn't only apply to lockdown versus red, it's red versus orange, et cetera, to limit those and not expose those populations to that unless it's really an essential visit and necessary to do so. So we haven't put that restriction on. We are asking people to adhere to that because around the lockdowns, as the Minister of Health announced, there are some have moved into red all around the GTA. So they are in the same type of number of limitations, considerably equal to that, and have to adhere to those limitations in certain facilities, social gatherings, et cetera, and even in the orange level around there. So adjacent has some of those same impacts, and those individuals want to do their best to keep their numbers down as well. So we're all in this together. That's why we're doing the framework, asking each group to do what they need to do, and that means you're responsible in your area, but also for the areas outside yours, because we know it affects the whole system. So we haven't put in travel restrictions. We're going to be trusting and confident that the public will do the right thing. And also those other ones in the outside areas do have limitations imposed by the red and the orange level restrictions.
Follow up?
Thank you. Premier, just about retail. So you're asking people to buy local, but you're ultimately putting Main Street at a disadvantage. Capacity limits at Walmart and Costco, but they can still hold dozens, if not hundreds of people at a time, while a small store selling clothing, as an example, they can cap it at 5 people. So if you don't want crowds of people to congregate, wouldn't a smaller store for in-person retail actually be safer than everyone going to Walmart or Costco?
Yeah, I hear you. And again, all these points, Colin, very valid, very good points. We've mentioned it to the health table. We've run through this over and over again. I know we all want to support small businesses. We really, really do, and I encourage it. And on the other note too, we have to keep the supply chain going for the large retail stores. I've had conversations with CEOs of the large stores. They're concerned about supply chain, and I've talked to some of the big manufacturers too, producers of, let's say, I'll give you an example, Kraft Heinz. I had a great conversation the other day with the CEO, and I have to just ask, I'm going to give a real request to all the big retailers, the Costcos, the Walmarts and Loblaws and Sobeys and Metro and so on and so forth. Please go easy on your suppliers. That's what I'm asking you. Please go easy, and please do not find these folks. They're struggling to put food on the shelves right now. I'll pass it to Dr. Williams.
So to be clear, in our lockdown in the areas you're concerned about, retail stores are not totally closed. They are open for curbside and delivery. And it has surprised me pleasantly. I've seen how innovative and how creative they are at dealing with that. And one before was saying they're so busy on the phones getting orders in, they have to have extra people manning those. And they can hand out probably more at the curbside in a short period than they could have if people came in the stores at different times. So I don't think it's out of the impossible. I think people need to, if you have your favorite stores, I would like the Premier say, you need to patronize those ones, and they need to be available to let you order and then go by and pick up and do it quickly because they've already paid ahead of time. So they're still open for business, whether it's on Main Street or in other settings. And I would recommend that you utilize those ones, as the Premier said, in the way of virtually as best as possible. and to do your curb pickups as you get ready for gift giving, etc. So that's there. It's open, and we want to utilize that as maximum way as possible.
Last question.
Last question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. Happy birthday.
Thank you.
Just would like to get some clarification on the mall stuff, how the malls are going to work. So, as we understand it, you can go into a mall, have a 50% capacity limit, and you can go into, say, an essential store in a mall, like a drugstore or a supermarket, but that other non-essential stores in malls can be open, but only for curbside pickup. So, would they have their doors closed and they would have to make an arrangement out in the mall parking lot or on the street for people to pick up goods that they've ordered online or over the phone? And how is that going to work? It sounds a bit confusing.
I'll pass this over to the Minister of Health or Dr. Williams, either one.
Well, you are correct, Rob. If any of the essential services stores within a mall can be open, a pharmacy, for example, or a grocery store, as you indicated. However, the other stores will be open for curbside pickup only, so you can order online. And it's our expectation that malls are going to have an outdoor location where people can come and pick up their purchases. They will have been paid for already, but we want to make sure that we don't end up with large groups of people assembling within the malls, but there can be places outside for them to come and pick up their purchases.
Follow up? Rob?
Okay, thank you for that. Sounds like there might be some big traffic jams in mall parking lots, but I'm going to move on to personal care services. So I'm just not sure how far that goes. So that's barbershops, hair salons, nail salons. Is that also massage therapists, chiropractors, dentists? Where do you draw the line on that? And any clarity is welcome. Thank you.
I'll pass this to Dr. Williams. Thank you.
Well, thank you, Rob. And we're going to be giving details out for those other specifics all along there. The point we're emphasizing is essential services, and you've outlined a number that we have asked to close, as you said, with hair salons and nail salons, etc., at this time in the lockdown zone. As well, but there's times like the dentist's office when there's emergency and necessary care. As before, they would work out ways to see these individuals through booking and using proper PPE because it is an essential visit and an urgent one, and that's necessary. So there's a cadre of ones, and we hope to be getting communications and information out as well as numbers to call for clarification. Because as you can imagine, there's a wide spectrum of different ones that people want to ask the specific questions about. And I want to make sure that that is done correctly. So I'm not going to go through that list right now, but we're going to put those communications and those numbers to call for advice and direction on what it means for this area and for your specific question.
That's great. Before we wrap it up, folks, I've said this before. You know, tough times don't last, but tough people do. And we have the toughest people, the most resilient people anywhere in the entire world. I want to give people hope. We have a vaccine that should be online shortly. Economically, we have proved, all of us, not just this government, but all of us, we had the economy on fire. We've proved we can create jobs. We're going to continue creating jobs once we get through this. We will light the economy on fire, the likes of which this province has never seen. Please, we're there to support you. We'll always have your backs. And again, I want to thank you for all the cooperation and collaboration. It means everything to us, and we will get through this together. Thank you, and again, God bless you and your families. Have a good weekend. Thank you.
Thanks, everyone.
All right, so we